vaccination rate enough that we really can put this pandemic behind us. We're not there yet. But there's no doubt that we are in a better place today than we've been at any point thus far during the pandemic. And that is because of medical science. It's because of research. It's because of the hard work of the healthcare community and the work of the Department of Health and our private partners, the pharmacies, the hospitals and clinics, and National Guard, everyone who've administered nearly 3 million doses of the COVID vaccine over the past 5 months. It's because more than 1.6 million Louisianans have at least started the vaccination process in order to protect themselves and their loved ones and their communities, and they're doing their part, quite frankly, to be a good neighbor and help us and the rest of the country move past this pandemic. Over the last couple of weeks, we've had almost 8,600 12 to 15-year-olds avail themselves of the vaccine. And so if your child is in that age group, please reach out to your pediatrician with any questions and schedule vaccination. You know, if you just look back where we were 1 year ago today, we were coming down off of that first initial surge that was so traumatizing. There were 2 more surges that were going to happen where the number of cases, the percent positivity, the number of illnesses and hospitalizations and deaths would go up tremendously. But we are in a much better place. I'll give you the numbers here in just a moment. And the difference of the vaccines, quite simply put, and I think Dr. Cantor is going to share more with you in a moment, but we know that they are working. Today, we are reporting 1,043 new cases on 22,907 new tests. Sadly, we are reporting an additional 13 deaths. That obviously hurts. And the grand total thus far during the pandemic is 10,548 Louisianans lost to COVID-19. You know, the deaths are actually harder to accept and understand now because they come months after the vaccine have been available, and we know that the vaccine is effective. And of those 10,548 deaths, 99.9% of them were unvaccinated. We have seen a steep drop-off in deaths among the older population, and that's quite simply because the highest percentage of people who are vaccinated in the state are those who are older. I think we're right at 75% of those who are 65 and older have at least started their vaccine series, and Dr. Cantor will give you more on that in just a moment. We are at an all-time low since the start of the pandemic, and the number of hospitalizations we're reporting today is 269 across the state, 28 of whom are on mechanical ventilators. So you may be wondering, if we're doing so much better and we're 14, 15 months into this now, why do we continue the proclamation? Quite simply because we have an awful lot of work to do. And the public health emergency allows the state to stay in the response mode to support local efforts and make sure that we are moving forward with the required immunizations and testing and the different things that are required every single day. For example, the National Guard. They have nearly 1,000 soldiers activated in support of emergency operations. They have administered right at 375,000 COVID tests. They work at food banks. They've packaged about 29 million pounds of food thus far. They have administered nearly 67,000 COVID vaccinations to the public. The Department of Health is also using state assets to respond to COVID, as are a number of other agencies. To put this into perspective, GOSEP is tracking more than $1.1 billion in state and local government spending that is fully reimbursable by FEMA. So we're going to keep the emergency order in place, and we'll keep renewing it every 28 or 30 days as long as the federal public health emergency also stays in place. And I want to tell you, COVID is not over. We are not yet on a one-way street that carries us only away from the pandemic. And that's quite simply because we don't yet have the percentage of people vaccinated in Louisiana that we need to have to feel that degree of comfort and confidence. But every day we get a little bit better, and more people are choosing to be vaccinated, but we have a lot of work to do. I anticipate that this may be the last press conference where I discuss the actual emergency orders, because if they change, we'll certainly let you know. But there just isn't a lot left out there to discuss. I will be with you again next week, because the session continues next week and the week after as well. So at this point, I'm going to turn it over to Dr. Cantor, and as always, I'd ask you to ask him whatever questions you have while he's up here, and then when he's finished, I'll come back up to wrap up and take your questions as well.
Good afternoon. Thank you, Governor. Thank you for your leadership. It certainly does feel like we've turned a corner in this pandemic, and it's, in recognition of the over 10,500 individuals in Louisiana who's lost their lives, and the countless sacrifices, big and small, we've all made. It does feel good. I mean, it's turning a corner doesn't mean that you're off the road, and there still is reason to be careful and vigilant, particularly if you are not yet fully vaccinated. But being able to regain even more normalcy is important. And I think it's important for us to recognize what we've all been through these 15 very, very long months. I'll talk a little bit about what allows us to safely roll back some of the measures that the governor alluded to, and this has been a progressive process. As the pandemic has unfolded, at each step, we really have let the virus lead. And when cases had gone down and the risk in the community lessened, it has allowed the state of Louisiana to roll back more measures and regain more and more normalcy. And that process clearly continues today. What specifically allows us right now to do it are a few things. Number one, cases are down. They're down across the state from where they were in months past. The risk is not zero, but it's certainly less than it was, let's say, around New Year's time and before that. And I'll talk a little bit more about those numbers in a second. We've now been below 5% positivity for about 4 months. And that's longer than most other states have. That's significant. The vaccines right now are widely available. In fact, it's never been easier in the history of the United States to get a vaccination of any type. You can get a free Uber or Lyft ride to any vaccine site. There are 1,500 vaccine sites throughout the state. There are no waiting lists. It has never been easier to get a vaccine, and that is significant. The vaccines that we have available to us, the Pfizer, the Moderna, and the Johnson & Johnson, remain good matches for the significant variants that are circulating at this point in time. That is significant. And we have much more knowledge right now than at any point prior about how this virus spreads from person to person and what individuals can do to protect themselves, should they choose to. All of those allow us to safely regain even more normalcy with the new proclamation that is about to be issued. I'll tell you, part of this process is going to be trusting each other. And if you remain unvaccinated, or if you've been vaccinated but not yet 2 weeks out, so you're not yet fully vaccinated, you still have risk to yourself of getting infection, and almost more importantly, you have risk to other people to spread it. If you remain unvaccinated, the clear recommendation from both the CDC and the Louisiana Department of Health is that you mask, particularly when you're in indoor spaces. That hasn't changed, and we're going to need to trust each other to do that. Part of this is also recognizing that the virus is in charge here. And as we've done every step of the way, should cases go up in the future, should we have another spike, should hospitals get busy again, there might be the need to roll some of this back or to get more aggressive with masking across the board. And as adults, we just need to accept that. But right now, the numbers look good. Let me talk briefly about what those numbers are and what the virus is doing. On the slide, you'll see the same four charts that we've looked at each and every time that we've entered into a new proclamation. And as they were last time we met, these continue to be very reassuring to me. I'll walk you through them. On the top left, you'll see what's called COVID-like illness, or the percent of emergency department visits that are attributable to COVID-like symptoms. It's a rough measure of, are people coming into hospitals with symptoms suggestive of COVID, and we've been relatively flat for the past 2 weeks now. On the top right, you'll see the incidence graph. This is the number of new cases, positive tests, unique individuals, so new diagnoses for an individual that get reported to us in the Department of Health every day, smoothed over a 7-day rolling average. And we've been on a large decline or plateau, a low plateau since the end of February, really. And then for the past 16 days, we've been on a discrete decline. They've been decreasing. And that's reassuring. On the bottom left, you'll see the combination graph where the purple line up top is the number of new tests being conducted across the state every day. We've held relatively steady the past month. We're on track for the month of May to conduct about 400,000 tests. And we know that that's an adequate number to get good visibility on the virus because our percent positivity remains low. Should the percent positivity go up, you really do worry if you're testing enough or not. We feel confident that we are testing enough to have good visibility on the virus. And then those orange bars in the bottom show percent positivity. We update this every Wednesday. I just got word as I was walking in here that the number for tomorrow, for the week ending today, will be 3.3%. That's down a tick from 3.4% on the week prior. And as I mentioned before, we've been below 5% positivity for about 4 months now. And perhaps the most meaningful measure to us is the bottom right, the number of patients who are COVID positive and hospitalized in hospital beds throughout the state, day on day. And for the past 2 days, we've had new lows in the state of Louisiana. And today is a new low. 269 COVID positive patients are hospitalized throughout the state. That's the lowest number that we have had since we started counting this in March of 2020 for our first spike. That's a marker both that viral transmission is slowing, the spread is slowing in Louisiana, and we have done a good job at incentivizing vaccines, promoting vaccines amongst the people who are most vulnerable. We've never seen any that more clearly than we have in the nursing homes. And if you go to the next slide, this is a slide that, one more slide. Yeah, that's the right slide. This is something that we showed a couple times previously, but it really does show the power of these vaccines, and that's why it's nice to keep looking at this. You'll see 3 spikes here on the blue line. The blue line is the number of new COVID cases in nursing home residents. And the red line on the bottom is the number of deaths in nursing home residents. You'll see the 3 spikes that correlate with the 3 spikes we've had for community transmission, the one back in March and April of 2020, the one in the summer of 2020, and then the run around Christmas and New Year's. And then right after that Christmas and New Year's spike, you see that blue line going down almost all the way to the bottom. That directly correlates with the increased vaccination coverage amongst nursing home individuals, clearly showing how powerful these vaccines are. And as the governor has mentioned a couple times in the past, in one of the most difficult to control areas there are. Nursing homes are challenging for COVID because it's a close congregate setting where the virus can spread very easily, and the individuals who reside there are amongst the most vulnerable. As of today, 83% of nursing home residents across the state have either initiated or completed the vaccine series, and that is profound. That's why you see that graph take such a sharp turn down. 42% of nursing home staff have initiated or completed the vaccine series, and as we've said a couple times before, that's a number that we're eager to see increase. It's creeped up a percentage point here and there for the past few weeks. We would like to see that number continue to go up. We watch the variants as we have been, and I'll walk you through where we stand with the variants. In short, I'll tell you that the good news here is that every variant of concern that we are tracking remains a good match for the available vaccines, and that is really important. The B.1.1.7 or the UK variant, the numbers have not changed from last Thursday when we talked last. In the U.S., about 74 or 75% of all COVID is the B.1.1.7 or the UK variant. In our region of the country, which is us, Texas, Oklahoma, New Mexico, and Arkansas, it's a little bit higher at 84.3%. For the P1 or Brazilian variant, nationally about 7% of all COVID circulating is this variant. Regionally for us, it's 5.5%. And we have identified 13 cases of the P1 variant in Louisiana. Of course, there's almost by certainty more than that we haven't identified, but we've been able to definitively identify 13 cases. Last week, we announced that we identified the first 2 cases of the B.1.6.1.7, or the India variant. These 2 cases were identified in the greater Shreveport area. Excuse me. Today, we can announce that we've identified a 3rd case of the India or the B.1.6.1.7 variant. This 3rd case is in the greater Alexandria area. Neither of these 3 cases are linked to each other. They're not relatives of each other. I can tell you that none of these 3 cases have traveled recently outside of the state, which means that in all likelihood they were exposed to the variant here in Louisiana, and we should assume that there's more of this variant circulating than has been formally identified. Importantly, none of these 3 cases have been vaccinated. And I think that's the take-home message for everyone. The best way to protect against the variants circulating now is to get vaccinated. Along those lines, the best way to protect against variants down the road is to get vaccinated now. And the reason is, every time the virus spreads from one person to another, it has the chance of mutating. Most of the time, those mutations are insignificant and irrelevant. Every now and then, a mutation is not insignificant and gives rise to a new variant of concern. The less people that are vaccinated, the more the virus spreads and the more it has an opportunity to perhaps form a new variant. So really the best way to prevent future variants is for more people to get vaccinated right now. As of today, we have administered over 3 million doses of vaccine in Louisiana. That is a testament to the hard work of providers throughout the state and certainly the National Guard, as the governor had mentioned. 35.1% of the state has initiated the vaccine series, and that breaks down to 45% of individuals 18 and older, and 42% of individuals 12 years of age and older. 31% of the state's population has completed the vaccine series, and 72% of everyone 65 years of age and older in Louisiana has completed the vaccine series. I'll tell you, every day that goes by, there is more data coming in that shows that the 3 vaccines that we have now, the Pfizer, the Moderna, and the Johnson & Johnson, are safe and they are effective. That is the bottom line. People should be encouraged to speak with their physician, speak with friends and family who have already gotten vaccinated. But every day there is more data coming in to show that these vaccines are both safe and effective. I've actually also saw data today from one of the dating apps out there, that this is true, by their data, that the vaccine also makes you 14% more attractive. And I'll remind you, it's very easy to get vaccinated. You can get a Johnson & Johnson shot today and be fully vaccinated in 2 weeks. In all seriousness, protecting yourself and knowing you're not going to spread the virus unbeknownst to somebody else is something that should be attractive to everyone. I'll tell you that the most stressful thing for me personally throughout this pandemic was the fear that I could unknowingly spread the virus to somebody else. And to me, that's the most important reason that I got vaccinated. So I would not, unbeknownst to myself, spread the virus and put someone else in harm's way. So please consider that. As we work to get more people vaccinated, you'll see a shift, both in Louisiana and nationally, away from some of the high volume, high throughput sites to smaller vaccine events. These are vaccine events in neighborhoods and communities, in churches, in partnership with community-based organizations, and also an effort to get vaccine into smaller medical practices. There are some things that really help us to do this now. A few things that are new, and I'll tell you what they are. Number one, last week the FDA announced that Pfizer has relaxed the cold storage requirements for their vaccine. Remember, Pfizer is the only vaccine available to you if you were between the ages of 12 and 16. We can now store the Pfizer vaccine safely in a regular refrigerator for up to 30 days. That is significant. That's going to make it easier for physician practices and other medical clinics to stock the vaccine. The CDC told us that we can now safely co-administer the COVID vaccine with other vaccines at the same time. That's important because a lot of kids in Louisiana, by virtue of the disruption of this past year, have fallen behind on their vaccine series or other vaccine series. And now when they go into their pediatrician's office, if their pediatrician has the COVID vaccine, they can give it at the same time as any other vaccines that they need to be caught up on. And the CDC is getting more pragmatic with their guidance around waste. We're going to recognize that as we move vaccine to smaller and smaller venues, like a small medical clinic, there is the chance for a small increase in waste, and that's because once you open up a vial, you generally have to use what's in that vial that day, or you lose it. What the CDC says, and I agree with this completely, is at this point in the vaccine program, we should not waste any opportunity to vaccinate someone. Meaning if someone comes in the clinic towards the end of the day, it might be worth it to pop that vial, even if there'll be a little bit of waste, because each vaccine given is potentially a life saved right now. So we might see a little bit more waste. I can tell you to date, we have wasted in the state of Louisiana, or lost, just shy of 12,000 doses of vaccine. That's on 3.85 million doses delivered to the state. So our waste or loss percentage is 0.3%, which is relatively low. I have made an ask to my physician colleagues throughout the state to talk about the COVID vaccine at every clinical encounter, at every opportunity, because I think a lot of people would benefit from hearing from their doctor what they think about it. I've made that ask to doctors across the state, but what I'd like to ask you is don't wait for your doctor to raise it in conversation. If you have not yet been vaccinated, or if family members of yours have not yet been vaccinated, take the initiative. If you have questions, reach out to your physician or your medical provider. Ask the questions that you need to ask to feel comfortable. I guarantee you're not going to be the first person to ask those questions. I'll pause there. I'd be happy to answer any questions if there are any. Yes, sir.
Are you aware of what the timeline is looking like for the other vaccines to be approved for residents 12 years and older?
Absolutely. The question is, when are the other vaccines going to be available for younger individuals? We got some good news late last night. So Moderna announced data on their trial of individuals going down to 12, and their data, from what this is self-reported by the company, so we haven't verified it yet, but it looks very similar to the Pfizer data, which is extremely efficacious and safe for those younger individuals. Moderna plans to make formal application to the FDA to amend their emergency use authorization in the coming weeks, and then we'll see how long it takes the FDA to decide on that. It took about a month for them to render a decision on the Pfizer. So I would expect between 1 or 2 more months' time for us to be able to use Pfizer down to 12 years of age, if the data turns out to be what they reported it to be last night.
How about Johnson & Johnson?
Haven't heard yet. Yes, sir.
How do you think the pandemic will change as the summer months carry on and things get hotter and maybe more people are together inside? I mean, what do you expect to happen?
Yeah, that's a great question, and the short answer, in all honesty, is I don't know. I can tell you how we're going to proceed, and that's letting the virus lead the way and continue to regain normalcy and be prepared to roll back if we need to. One of the concerns of mine is, what happens in the summer months here is analogous to what happens in the winter months up north, which is the weather drives people indoors more, and we know that that can increase transmission. So that's a liability for us. On the other hand, what we have going for us is that the vaccines available are plentiful in supply, and there's still a good match for the variants out there. It's really easy to get vaccinated. So I think that's going to be, what determines it. I'll tell you, if more vaccinations happen, if more people choose to get vaccinated, and if people follow the guidance, which is if you're not fully vaccinated yet, you still wear a mask when you're indoors, I think we're going to be well protected. If either of those two things don't happen, I think we'll be at liability, but we'll have to wait and see what happens.
Okay.
Thank you.
Thank you, Dr. Cantor. And one other piece of information I want to point out, and it was actually put up today, but the national rank in per capita cases for our state is now 31. That's the best we've been at any point in the pandemic. And if you remember that we started off number one, and we're number one in the country for a number of weeks at the outset of the pandemic, I think that indicates the manner that we've managed the public health emergency, and I want to thank the Office of Public Health because you all have been primarily responsible for that. And that certainly could change before everything is over. But when I see that we're number 31 today in per capita cases, and we were number one for so long, I can't help but be very thankful for all the professional public servants and all of our wonderful partners in healthcare providers and so forth all across the state. I know that this week we finally have some nice weather, and so people aren't wanting to focus on bad weather. By the way, the weather's good this week, but we still have several parishes with low-lying areas where they're still engaged in a flood fight because of all the rain that we had last week. But hurricane starts 1 week from today. I'm sorry, hurricane season starts 1 week from today. So please, everyone, do what you need to do to make sure that you and your family are fully prepared. Go to getagameplan.org. It's got a listing there of all the steps you need to take, the supplies you need to have on hand. The rule of thumb is to make sure that you and your family can stay in place successfully for 72 hours. Obviously, we will always endeavor to deliver assistance as soon as possible and hopefully long before 72 hours. But that's what we're asking families to be prepared for. In addition, this year, having a game plan means getting a vaccination. Because if you have to shelter, whether it's with friends or family, or whether it's at a shelter, for example, our mega shelter in Alexandria or shelter in Shreveport, we want people to be safe for all the reasons Dr. Cantor was talking about. We want you to be safe, we want your family to be safe, and everyone that you all come into contact with. So in addition to visiting getagameplan.org, we also ask you to visit vaccines.gov. It'll give you a listing of more than 1,500 locations around the state that you can receive a vaccine. They're available now. But it'll also give you an opportunity to schedule those vaccines if you call the hotline 1-855-453-0774. That's 855-453-0774. That's the hotline. You can find out where the nearest location is that's convenient to you. You can schedule a vaccination. You can even schedule an in-home vaccination if you're homebound. And if you need to speak with a medical professional because you have questions about the vaccines, they can make that possible for you as well. So all of that relates to COVID, but it also relates to the approaching hurricane season. And then if you were one of those families who were adversely impacted by last week's weather and you've not yet filed a damage report, please make sure that you report your damages. You go to damage.la.gov, damage.la.gov, and you can complete a preliminary self-report survey. About 1,800 of these have been done across the state thus far. We know that we're getting close to 500 homes with major damage. About 5 homes have been reported as completely destroyed, 2 of those in Iberville. one in Acadia, one in Calcasieu, and one in East Baton Rouge. And this is the information that we need to have so that we can coordinate with the FEMA officials and determine whether we've crossed the threshold where we can avail ourselves of a federal declaration and the individual assistance that that might provide. So we're asking everyone, if you haven't done it yet, visit damage.la.gov, complete a preliminary self-report damage survey so that we can aggregate all these numbers. At this point, I will take a few questions. Yes, sir.
Can you update us on your plan to possibly institute a vaccine lottery or other incentive program? I noticed where the White House gave its blessing on that, and it seems like there have been some good success rates in those states. You talked about it previously, but you said you don't have details. Can you update us on that?
And I haven't had the vaccination update meeting this week. I do anticipate that we're going to soon institute some incentive programs. We had a call today with the White House, and all of the nation's governors were on the call, and we heard from incentive programs being offered in Ohio. Governor Mike DeWine spoke to us about that. Governor Janet Mills of Maine spoke to us also about incentives that they're offering in Maine. And they were selected because they had some ideas and were kind of first out of the gate with them. Believe they may represent best practices. I'm not prepared today to make the announcement, but we are certainly going to be doing some incentives in the near future, and we'll have an announcement for you. I just hope people don't wait till there's an incentive, and that they will take as an incentive the promise that a vaccination offers for your health and for the health of your relatives, your coworkers, people that you go to church with, strangers you don't even know. But we will be implementing some incentives pretty soon. And by the way, we also received some clarification that certain portions of the American Rescue Plan funding that's been made available can be used. Not all of it, but certain pots can be used to pay for certain incentives as well. But, well, we always appropriate federal dollars to the legislature here in Louisiana, and so it would require coordination with the legislature. But this clarification just came down, and so we're starting to look at it right now as to what we can do. Yes, ma'am.
Have you started those conversations with the legislative leadership about what kind of funding you would need and what you're looking at? Because obviously time is getting short.
No, you're right, and we have not. Again, we were just told, I think today in the call, that certain funding is going to be available for those purposes, and I need to look and see where those dollars are, because they're not part of the large, as I understand it, they're not part of the $3.1 billion large American Rescue Plan funding stream. They're parts of little pockets that have already been made available to us, and so we'll be looking at that and getting with the legislature. Yes, sir.
So Biden announced that he's doubling federal funds for ahead of this hurricane season. So how do you expect that money to be spent, and how it'll help prevent some of the damages?
Yeah, well, and I know that there's going to be particular emphasis on those areas that have particular challenges because of their socioeconomic conditions in terms of creating more resiliency. I know that there's a doubling of funding to, I think it's $1 billion this year. We haven't been apprised as to how much of that's going to be available to us, or exactly, where we would spend it and so forth. So I don't have the details for you right now, but the resiliency is something that's very important for us, as you know, in Louisiana. I mean, just last week, we didn't have a named storm, but we had a number of parishes who suffered flooding and continue to suffer flooding. And we have homeowners and business owners who've suffered losses as well. And one of the things that we continue to emphasize with the White House and with the Congress is the need for a disaster appropriation so that we can not just repair damage, but so that we can become more resilient in the future and not suffer all of the devastating damages that occur from these natural disasters. But that announcement came just the other day, and it hasn't been broken down in terms of state by state what we're going to get and how that funding can be spent. But we certainly welcome any funding we can get in Louisiana that would enhance our resiliency. Yes?
I guess nationally, there's sort of celebration of some kind today about reaching 50% of adults vaccinated. Louisiana's lagging behind, obviously, and nowhere near that number. I mean, what do you think that says about Louisiana? And is there any, course correction that you think your administration needs to do to bump that number, or why are we lagging?
Well, that's a great question. I guess I would start by saying, why is there more hesitancy here than there is elsewhere? I don't think that's tied to our approach at the state level, and in fact, that seems to be a regional issue. And if you look at the percentage of eligible folks who've actually initiated their vaccination series, I think we're second to last in the region. If you look at those who've actually completed the series, we're second or third best, but that's in the region. And admittedly, this is in terms of vaccine utilization, the poorest performing region of the country. So not great numbers by any stretch. All I can tell you is we're working extremely hard every day to make it more accessible, more convenient, to instill more confidence. And quite frankly, we always knew we were going to get to this point. We just hoped and believed it would be much later than it actually came. But making sure, for example, that every physician-patient encounter doesn't just allow for an opportunity for the physician to speak to the patient about the necessity of being vaccinated and how safe and effective they are, but also having that vaccine there so that it can be administered on the spot. Doing that in emergency departments, doing that upon discharge from hospitals for people who are unvaccinated, and all the clinics, including now the pediatric clinics, for example. All the clinics where people who are especially vulnerable to disease have to go. So whether you have heart disease, kidney disease, or diabetes, you know it. So we're doing all of those things. We have over 1,500 locations in Louisiana today where vaccines can be administered. If your church contacts us, we'll go do a vaccine event at your church. If you can get enough employees, we'll come to your place of work. If you've got other areas where you know that a number of people are going to be gathered and want vaccines, contact us. We'll come out and do that too. So quite frankly, we're always working to improve. We're never going to say that what we're doing is enough or that it's perfect and we don't make mistakes. But quite frankly, it's hard for me to see how the state effort is responsible for the lagging rate of vaccinations. We just have to instill more confidence in the people. And again, this seems to be an issue in our region. And quite frankly, it's not one that I can explain very well because it's hard for me to understand it. We know that the vaccine is safe and effective. We know it's the way through the pandemic. I mean, just think about that chart he showed you a while ago with nursing homes. That's with nursing home residents at 81%, I think now, who are fully vaccinated. These are people who, by definition, are vulnerable to disease because of their age, because of their comorbid health conditions, and they live in congregate settings. And the cases and the deaths have declined so precipitously, and they're almost at the y-axis now. And if that can be achieved at 80% in that setting, just think what will happen if we can get to 60 or 70% overall. And so we're going to continue to work extremely hard, and we're not giving up. It's just harder. And but I will tell you that the people will have to be the ones that ultimately choose to avail themselves of the vaccine. We just want to help them make that decision and make it available to them on the spot when they do make the decision. Yes, sir.
It was last week, Louisiana State Police released the body cam footage in the Ronald Green case, and the world got to see what Louisiana State troopers did on that video. What's your response to that, and do you think their actions were becoming of a Louisiana State trooper?
No, I do not, which is why I've always said that after the very first time I watched the video that I found it disturbing. I wouldn't have been disturbed had I thought it was professional, had I thought that those officers had performed as they should. They did not. They don't represent what we aspire to in the state of Louisiana at the Louisiana State Police, especially once Mr. Green was not just in custody but was restrained. And that's why this matter is under investigation, active investigation by both the district attorney in Union Parish where the incident occurred, but also by the U.S. Department of Justice. And it is regrettable. It is unfortunate, and obviously we have implemented a number of changes with a goal towards making sure that this does not happen again. And so, no, they were not professional. They did not conduct themselves as a law enforcement officer should. And quite frankly, I'm disappointed in officers who were on the scene who didn't intervene as well. That evidence is a lack of professionalism also. Okay, look, thank you all very much. The next press conference will be next week? Thursday? Yeah. All right, so not this Thursday, but next Thursday, and we'll see you then. And again, I would ask people to keep the Romer family in your prayers, and let's pray for one another, and let's get through this pandemic. Let's make sure that we're vaccinated. Thank you all.